morning, everyone, and welcome to our Monday Minute. Today, we're going to discuss some medical review key points. One specifically that we have seen medical reviewers really begin to deny if the documentation that's expected is not there. There are several things that are required on individual visit notes. I know clinicians get so tired of hearing medical review discussion about painting the picture of the patient's situation, but the reality is medical reviewers don't have anything except documentation in the chart. The medical reviewer doesn't have the patient in front of them. They don't have the opportunity to interview the patient. They don't have the clinician in front of them to ask questions. So all they have is your documentation. And so as you go through the documentation of individual visit notes, the expectation is that there is documentation to support the plan that is going to be provided to that patient, specifically the skilled service that is provided to the patient that day during that specific visit, the patient's immediate response to the services that have been provided to the patient, and then the key point of today, the reality that you are required to document the plan for the next visit. So EMR systems have been very, very helpful in the documentation world of home health. There's no doubt. Electronic documentation, it's almost impossible for an agency to be without it these days. But the reality is those electronic EMR documentation systems sometimes give the clinicians the ability to simply use a checkbox or generic language. And in many cases with the plan for the next visit, we are allowed to mark a box that says, see the plan of care or continue the plan of care, that kind of language. The reality is that is no longer going to work under medical review. The requirements in the Medicare Benefit Policy Manual specifically state that the agency is to document the actual plan of the care that is going to be provided, the skilled service that's going to be provided on the next visit. We have seen just in the last few weeks several denials in home health because there has not been adequate documentation to support the plan for the next visit. Some of you think this is a really picky situation, meaning, are they really going to go down that road? And the reality is they are going down that road. And the documentation in the Medicare regulation is clear that you're required to document specifically what is planned for the next visit. We simply have had medical reviewers in the past that have not picked that particular item to hone in on. And now they are determined that they're going to do it, whether we want them to or not. So the reality is you need to be very specific about the service that has been provided to the patient in the form of skilled care, whether we're talking about a nursing visit or an aid visit or a therapy visit. And in addition to that, the patient's immediate response to that visit, to that service. And then of course, as we've already reiterated, the detailed plan for the next visit that's going to be provided to the patient by the discipline that is documenting this information. I hope that today has been very helpful to you. Currently, there is extreme activity under targeted probe and educate, UPIC audits, SMRC audits, etc. And we really, really, really need to be very meticulous about our documentation to ensure that if any of those medical reviewers come knocking at our door or our email box, we are prepared with documentation that will support the amazing care that we provide to our patients and be able to get through those medical reviews without any issues whatsoever. Thank you all for participating today. And if you need assistance of any kind from HPS, don't hesitate to let us know. Thank you and have a fabulous week.